Excellent. Well, thank you so much for joining us today for the American Heart Association's Understanding Heart Disease educational webinar featuring Dr. Robert Groves and brought to you by Banner Aetna. My name is Corinne Kleinschmidt, and I'm the Vice President of Health for the Greater Phoenix American Heart Association. And we're very excited to bring you this digital experience via Zoom today. Before we get started, there are a few housekeeping things I'd like to take care of. First, as you heard when you joined, we are recording this session, and that way it'll be available afterwards. At the end of the event, you'll receive an email with a copy of the presentation slides and a link to that recording. So while we'd love for you to take notes during the presentation, please know that if you miss something or you want to hear it again, you will have access to the webinar afterwards. Also, live captions are turned on automatically for all attendees, and if you'd prefer to experience today's event without the captions, click on the live transcript button at the bottom of your Zoom toolbar and select Hide Subtitle. For those of you new to Zoom, I'd like to take a moment to go over a couple tips to help you enjoy the session better. First, to change the view you have, click the word View in the top right corner of your Zoom screen, and you can select Speaker View to see the speakers better. And there's also other options on the View menu, so pick which one you like the best. And let's make sure we all know how to ask questions. When you join the call, you were given the main event window. You click Chat to have the chat window added to your view. The slide I'm showing has a picture of what that looks like. And then if you want to remove the chat window, you just click Chat again and it'll come down. You can also move the chat window around your screen if it's over something or covering up something you don't want it to. You just grab it at the top and drag it with your mouse. When you have the chat window open, you can type in responses and questions. You can choose to message all panelists and attendees to send it to everyone, or a specific person like a host or presenter. We do encourage you though to send it all panelists and attendees. That way we can help answer any questions and comments you might have. So we'll test what we've learned. Open your chat box and type in the answer to this question. What is your favorite heart healthy lunch? Since it's lunchtime and some of us are probably eating right now. Select all panelists and attendees as you type in. Salmon, lots of salads. Oh, tuna salads. There's a lot of, if you see this, Dr. Groves, there's a lot of seafood salad lovers here. I'm not a huge fan of seafood in Phoenix, but I do love it when I go to California. Oh, yeah, I say gluten-free, nice. Perfect. You guys are doing excellent. Thank you guys so much. And remember, throughout, select all panelist attendees when we're asking you for questions and submit questions anytime throughout the presentation. If we have time at the end, we will answer them and I will have them for Dr. Groves. As we get started, I'd like to give a special thanks to our sponsor, Banner Aetna, for making this event possible. We're excited to work with them to provide this invaluable information about heart disease and how to reduce your risk. Banner Aetna is Arizona health insurance company, and it leverages the strengths of two of the largest healthcare organizations here in Arizona, Banner Health and Aetna. Thank you, Banner Aetna, for your support. And today I'd like to welcome Dr. Groves, who is the Executive Vice President and Chief Medical Officer for Banner Aetna. In his current role, Dr. Groves is responsible for population health management. He received his MD from the Medical College of Georgia and previously served as the Chief Medical Officer for Banner Health Network. Today, he's going to explain what heart disease is, its warning signs and actions, and how Life Simple 7 Plus, those risk factors that individuals can improve through lifestyle change, will help you achieve optimal cardiovascular health. Dr. Groves?
Thanks, Corinne. Thank you to the AHA for the amazing work. American Heart Association does amazing work in this community and communities all around the country to address what is still the #1 killer. 1 in 4 adults in the United States as it comes to heart disease. So this is still a major problem. And, one of the things that we've glossed over perhaps is it's still the #1 killer in women too. So just to make that point so that everyone's aware of it. Okay, so what is heart disease? Heart disease is sort of a blanket term, if you will, that is used to usually refer to coronary artery disease, but there are really several types of heart disease. And so I thought it might be helpful to go through those so that you learn what those are and how they might relate to that big muscle in the center of your chest that pumps oxygen-filled blood throughout the body. We can also use the term cardiovascular disease. Now, in the types of heart disease, let's go ahead and walk through it. Coronary heart disease. Now, this is the one that most of us are familiar with. This is the problem that causes a heart attack, and it's narrowing of the vessels, the arteries specifically, that feed the muscle of the heart that lead to a heart attack. That muscle starts to literally die for being starved of oxygen when those vessels become severely narrowed or occluded. But there are other types of heart disease, heart failure, for example, which I've always thought is a little bit of a misnomer because the heart hasn't absolutely failed at this point, but the muscle has gotten weak, and that can happen for a variety of reasons, but the end point is a serious but treatable condition. The heart is not able to keep up pumping blood, and there are medications and other things that we can do to assist the heart to maintain oxygen delivery to the body. Irregular heartbeat. This is an electrical problem with the heart. The heart has to go in very careful sequence. It's coordinated so that the tiny pumps called the atria can move blood into the bigger pumps called the ventricles, and that sequence has to be very precise. And by the way, one of the things that you may know is that often when the heart muscle is deprived of oxygen, as in coronary artery disease, one of the first things that happens is an electrical problem. And that's why CPR often works, because you sort of jumpstart the heart, if you will, after that immediate electrical problem and buy some time for us to intervene. Not all electrical problems need to be treated. There are some that are relatively benign, but a fair number of them actually do, and that's something you'd want to discuss with your doc if you feel like your pulse is very irregular. Heart valve disease. I mentioned that the sequence is very important, that the top chambers, the atria, pump before the ventricle, and that they are in rapid sequence together. And the reason that works is because there's a set of one-way valves, 4 of them in total. And if those valves become leaky or they become tight and obstructed, that can affect the function of the heart as well. Cardiomyopathy is literally a muscle disease of the heart. It can be from a variety of causes. It can lead to a variety of problems, including electrical system and heart failure, and it is treatable in many circumstances, but that's another way that the heart can cause you problems. And then, of course, there are the congenital defects, holes between the ventricles or between the atria, and there's a whole variety of these. And heart surgery for congenital heart defects is certainly available and has come a long way in the last 2 or 3 decades. So let's look at the anatomy a little bit. Coronary arteries, and those are, you'll see the notation of the left anterior descending artery down there on your right, the marginal branch, the circumflex. These may be terms that you've heard before, but all of these are the arteries that supply the muscle and the electrical system with oxygen. And of course, that muscle, just like every other muscle in your body, every other cell in your body, needs oxygen to survive. The heart really is the pump, the system that pumps blood both through the lungs from the right side of the heart to pick up oxygen and get rid of waste product, CO2 primarily. And then once it's picked up that oxygen in the lung, it falls into the left ventricle and is pumped out through the big vessel, the main vessel that comes out of the heart. You'll see it as the aorta there, or the aortic arch. And if you'll follow that shadow, it goes down behind the heart. Right off of that arch is where the coronary arteries originate. And those are the ones that can give us trouble in cardiovascular heart disease. And one of the main causes of that is fatty deposits or plaque buildup in the walls of the arteries. And that can be from a variety of causes as well. We're starting to believe that inflammation plays a major role. And the thing that you don't see here as we progress through narrowing of the arteries is that it makes the arteries very stiff and non-pliable, if you will. It looks like just fatty stuff. Why would that make that happen? But the plaque actually includes not only fatty stuff, but debris and stuff called fibrin and calcium, which is why some studies look at the amount of calcium. What happens typically when somebody has a heart attack of some kind is that plaque ruptures. And when it does that, it exposes that sensitive underside of the plaque, if you will, which attracts all sort of clotting chemicals to the area. And then you start to have a frank blood clot in that area where the plaque has ruptured. We're moving on through now, and you can see that forming there. The plaque has ruptured, and right on that inside surface that's now been exposed to the bloodstream, all those mediators in the vascular system start to accumulate there and form a clot. And if that clot gets big enough, it can totally occlude the vessel. And there you see on the left there, that can lead to cardiac tissue that can actually die if that clot stays there too long. And that's why it's an emergency. If we can get in there and free up that clot or put a balloon in and dilate it, get it out of the way, essentially, then we can save that myocardial tissue that is at risk. If it's too late and the tissue has already died, we can't save that tissue, but there are so many things that we can do to make sure that the person with this problem has a much better chance of walking out of the hospital alive. Okay. And there you go, a normal artery on the left. That's what it looks like when we're born. It's nice and smooth and pliable. It expands and contracts easily with blood flow. And on the right, you see a plaque. And that atherosclerotic plaque, as it's called, can induce progressive narrowing. And if it's very narrow, we might get something called angina, which is chest pain that doesn't lead to a heart attack. It's temporary, and we can treat it with medication. But remember that sudden death is often the very first sign of coronary disease in folks who haven't had regular evaluation by their physician. Okay. All right. This is your first challenge of the day. When it comes to heart attack warning signs, men and women can experience different symptoms. True or false? See, I'm not seeing results here. Oh, there we go. Wow, this is a smart crowd. It absolutely is true. And in fact, that's one of the reasons that historically women have been underdiagnosed with heart disease. And we'll talk about what those differences are shortly. Short video.
It started out like a totally normal day. Mom! Okay, move objection deadline to the third line after survey. Oh, honey, for when you always use the verb that's the heart. What are you doing down there? Did you finish your breakfast? Ow. Don't hit your brother. I mean, you have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
You sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Wear your shoes. Put your shoes back on, please. You know, go help your sister. We're going in 3 minutes. Oh, my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, here. Nobody move! I'm getting a dustpan.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down. I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. So now I take care of my heart, and I tell the women in my life to do the same.
Sounds great, by the way.
That's nice, sweetie, but that's not my heart. That is. Make it your mission to save your life and the lives of the women you love. Find out more from the American Heart Association at goredforwomen.org.
Now we're going to talk about the warning signs, but first of all, does that look familiar to anybody? That kind of a day can happen to anybody. And when stress goes up like that, there are a number of systems in the body that put out mediators that do vessel constriction. You're basically getting ready for fright or flight. That's what high stress does. And she doesn't look like the typical heart attack patient, so that can be deceiving. And she doesn't start out with typical symptoms. She's having a little pain in the jaw, her arm hurts a little bit, and it's not till later on that she starts to have the real chest discomfort. Not everybody has that, and as you can see, like most people, she's downplaying it, couldn't be me, but that can be a very dangerous thing to do. She had a great kid there who informed her that, you know, this is the real deal and you need to pay attention to it. Could have ended much more tragically if that had not taken place. So don't be shy and don't be afraid to let somebody know, and even call 911 if those symptoms start to occur in you or somebody that you love. Now, chest discomfort is the classic sign of heart disease, and often it's described as a pressure in the chest that's a tightening that can lead to shortness of breath, and patients even describe feelings of impending doom. That doesn't have to be there, obviously, but the body is trying to tell you that something is really wrong. Lightheadedness, nausea, and vomiting can be part of the problem, for sure. And jaw and neck pain. We don't think about this very often, but sometimes the only presentation, particularly in women, can be jaw and neck pain. Discomfort or pain in the arm or shoulder. You'll often hear healthcare workers ask you, does it radiate? That's what they're talking about. Does it go anywhere besides your chest? And that's what they're looking for. And then, of course, shortness of breath. And all of those things can, even individually, represent a heart attack. The thing that's puzzling is that women typically do not have the classic central chest pain, certainly not as the first symptom. Most of the time when there are unusual symptoms, it's in women, and it has caused us to miss that as a diagnosis historically. But now that we're much more aware of it, hopefully we can get on top of it and make sure that it doesn't happen to anybody that we love. Okay. What happens if you're not quite in time and you have something called sudden cardiac arrest? And what is CPR? And there's some new developments in CPR. I hope many of you have heard of this, but if you haven't, I think you'll be happy that we have a strategy now that really is easy for almost anyone to do. If you witness a cardiac arrest, someone who suddenly drops, maybe clutching their chest, outside of a healthcare setting, okay? And by the way, there are about 5,000 people who have a cardiac arrest in Arizona each year. 90% of the people who die after, 90% of the people who have a cardiac arrest outside of the hospital don't make it. And out of hospital cardiac arrests typically happen in homes and residential areas, but only about half of the folks who have a heart attack actually get the right intervention, actually get immediate help before professional help arrives. So it's something worth learning about. If you want to take care of your loved ones in the best way possible, it is the #1 killer. Having a little bit of information about what to do in the situation not only takes a little bit of the stress out because you're in control now, you know what to do, but also may save someone's life. And there's a reference if you want to learn more about it. And I think, if I'm not mistaken, we have a little short video, Corinne.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Stayin' Alive. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life.
Now, before we go to risk factors, I want to emphasize that for many of you, this may be new information. For some of you, perhaps not, but it really is so simple. It's 2 steps. You call 911, and then you simply do chest compressions. There's no recommendation for anybody in the non-healthcare population to do anything other than that. And we know now, the science is out, that this is an effective way to keep somebody going until professional help arrives. We're very fortunate in this country that typically that is very, very quick, although for those who are in this situation, I'm sure it seems like forever. But learn as much as you can, because it's a 2-step process that quite literally anyone can learn. So now we're going to talk a little bit about the risk factors. And I would first ask you which one of these, or which of these, are uncontrollable risk factors for heart disease. In other words, there's nothing you can do about them. And do we have a list, or, well, I can quote them to you. Age, oh, there we go. Family history, prior heart disease, and then the 4th answer is all of the above. Okay, go. See if we've got some results there. Pretty darn good. Again, this is a smart group, doing well. Those who are in the majority are correct. Can't do much about your age. All of us are getting older every day. You can't do much about your family history. That's the genetics that you were born with. And so those are the uncontrollable risk factors for heart disease. Oh, and previous heart disease, obviously after you've had it, there's not much you can do about that either. Gender, men are more likely to have heart disease than women, but again, it's still the #1 killer of women. And then race has an influence too. African Americans are at higher risk for heart disease than other populations, and it is estimated that probably half of adult African Americans in this country have cardiovascular disease. So it is a major problem and one that deserves our attention. So what are the controllable risk factors? And these are the things that you can do something about. And let's start going down that list. Physical activity, very important. We know that people who are active are much better off than those who are not. We could spend, by the way, probably an hour on each of these. And so you ask, what does physical activity mean? I think the current recommendations are for moderate activity. I think it's 150 minutes a week. I'd have to look at my reference here to get that exactly right. But what do we mean by moderate physical activity? Well, that's to the point that you notice that you're exercising, but you can still carry on a conversation easily with somebody that you're walking with, for example. So walking is a perfectly good way to get this kind of exercise. And by the way, those who move at all are far better off than those who don't. So any little bit really helps. In terms of vigorous physical activity, you can do that for less time. I think it's 75 minutes, and if you do that 3 times a week. And then we also recommend that you do some strength training. There's a loss of muscle mass, and it doesn't have to, you're not pumping lead at the gym necessarily, but resistance exercises with bands or small weights, etc., just to keep those muscles active and in good shape. And all of those things reduce your risk, not only of heart disease, but of a variety of other issues that we encounter as we age. Unhealthy diet, this is a big one. High sodium, high sugar, added sugar diets. There is a tremendous amount of junk food that is part of our everyday life. You look up DoorDash or Uber during the pandemic, and it's hard to find foods that are really decent. I mean, the vegetables are all fried, and there's high-fat meats, and it's just not something that looks good in terms of your heart and keeping it healthy. And so understanding how to manage that diet is a big deal. Let's see, we're going to go to high blood pressure. We talked about this at our last session, and I think those of you who were at the last session remember how important it is to manage the blood pressure. Weight, those who are overweight or obese increase their risk for heart disease. And drinking too much alcohol can be a problem too. And what's too much? Actually, it's more than 1 drink for women and more than 2 drinks for men. And that has to do with, on average, how we metabolize alcohol. Then there's sleep apnea, which is a disorder of breathing that's often associated with weight as well, where someone stops breathing in the middle of the night. You may hear it as snoring that gets louder and louder and louder, and then it stops completely, and there's a pause, and they don't seem like they're breathing, and you might wonder, are they going to take the next breath? And then they do, and that literally is an obstruction of the airway in the back, and there are very good treatments for that, which reduce the risk of heart disease and hypertension. And then there's high cholesterol. We've all been aware of this. There's some newer insights on high cholesterol, but it is something that you want to check and work with your doctor to make sure that you have it under decent control. Diabetes, we've talked about, I think before, is a big risk factor for heart disease. It tends to affect the smaller vessels in the body, but over time that can lead to some significant problems with the heart, including heart attack. If you don't know that smoking and tobacco use is bad for you, then you just haven't been paying attention. Anyone who smokes, the #1 thing by far that you can do to improve your chances of staying healthy and staying alive is to quit smoking. It's not easy, but it's worth it. And then finally, stress can contribute significantly, particularly stress that is not managed well. We're all going to have stress. That's part of being alive. It's how we manage it and how we manage ourselves during stress that has the bigger impact on the outcome of that stress. Okay, here's a fun one. Which controllable risk factor do you find hardest to manage? It'd be interesting to see where the group falls on this one. By the way, for me, it's diet. I'm on the road a lot, and it's very, very difficult to stay focused on eating a good, healthy diet. Do we have some results there, Corinne?
Yep, for this one, they're typing in the chat box. And diet seems to be the winning one, to be honest. And then physical activity, and then a lot of folks mentioning stress.
Yeah, stress and diet. Yep, I'm with you. Yeah, it's not easy. It's not simple. But again, it's worth it. All right, let's go to the Simple 7. And this is the AHA's solution to a simple way to remember how to reduce your risk of heart disease. So number one, first and foremost, if you smoke, do what you can to stop. And there are lots of strategies out there now to help you quit. You can tell family members, etc., but work with your provider and make sure that that's the thing that you do. Eating better is a big deal, as is getting active. We talked about this, losing weight, managing blood pressure, controlling cholesterol, and then finally reducing blood sugar. Let's go through those. Eating better. Eating a variety of healthy, nutritious foods is a good idea. We can all improve our diet, I think. Concentrating on smaller portions too. Our plates have gotten bigger and bigger over time, and we've sort of gotten used to all you can eat strategies, and that's really not what your body needs or wants. Sometimes eating can be a response to stress. When we are fatigued or stressed, we often eat mindlessly, if you will. Adding fiber can help you fill up and feel full without having to continue to eat high density foods. And by the way, fiber slows the absorption of blood sugar into the bloodstream. Many fibers do, and that helps keep those insulin levels and blood sugar levels down. And it's a great idea not to buy empty calorie foods. Things like sugary drinks. And the way I've thought about it, and I've been told this before, is when you're in the supermarket, shop around the edges. Because that's where the real food is. The stuff that has all kinds of additives, used to have so many trans fats, now still with a lot of added sugar. You'll be amazed if you look on the labels what goes into the food that ostensibly might look healthy on the outside, but once you look at the ingredients, you realize that you're buying a lot of empty calories, and calories that lead to a higher risk of heart disease and other problems. So what does eating a healthy diet look like? Well, there are some basics that you can do. And what's interesting about diet is we're learning that diet is very much a matter of individual titration. In other words, everybody's a little bit different in terms of your tolerance for carbohydrates, in terms of your predisposition to vegetarianism. There are so many issues that go into this. The best advice that I can give you is stay away from those inside aisles at the supermarket. Eat whole foods when you can. Learn what your carbohydrate tolerance is. Work with your healthcare providers, and preferably an up-to-date dietitian on what the strategies are that can address this, because they can go from one end to the other, from a vegetarian to not, and everything in between. It really is a matter of tailoring it to your specific body. Next slide, please. Big deal here. The key to really managing diet is cook more at home, because you're much more likely to buy those whole foods and not go with a frozen something that you just heat up. Plan ahead at restaurants. Kind of have an idea before you go. That's so easy nowadays with online access to menus. Make a plan so that you know what you're going to get before you get there, and don't make a rash decision. And finally, grocery shop wisely. Again, go for those whole foods, stay around the edges. Exercising and maintaining a healthy weight. We talked about this a little bit already. Make your decision to get moving. If you haven't exercised in a long time, or you're getting up there, close to my age, then you probably should talk with your provider before embarking on that plan. But it can start slowly. You don't have to start with a marathon. You can start with a little bit each day and slowly increase over time. And it helps to do it with a friend. You're much more likely to stick with it if you make it enjoyable. And as I mentioned, walking is a great strategy and one that all of us can do. There it is. You can break it up into 10 to 15-minute routines over the course of the day. And that, it turns out, is just as effective as one long workout, as long as you get up to the level that's needed for your particular strategy, whether it's moderate or more aggressive exercise patterns. Stop smoking, and we'll hit this one more time because it is so important. In this country, it is the #1 modifiable cause of death, and that is simply put. So talk with a provider, focus on the rewards, plan a response. You know you're going to get triggered when you're driving on a long trip or after a meal or with coffee in the morning. Plan your response to those roadblocks and choose your reinforcement. Get your family on board, use one of the apps that's out there. The AHA has some solutions to help you make this happen. And by the way, don't just get discouraged if you don't get it the first time. Most people who quit have to keep at it. Managing your blood pressure, critically important. We talked about this before. It is the single most significant risk factor. 50% of adults have high blood pressure. Many of us who have it aren't aware that we have it, so getting it checked on a regular basis is important. It's become easy for you to do this at home now. There are great cuffs out there that will help you track your progress. You can track it and share it with your doctor. And I think on the next slide, we have the zones of blood pressure management. And so it is normal if the top number, systolic blood pressure, is 120 or less than 120, and the bottom number is less than 80. That's normal. It starts being elevated when you go over that, all the way up to about 130 on the top number. You'll notice that the diastolic doesn't change. Once you get to the 130 to 139 over 80 to 89 level, you have hypertension stage 1. And from there, we have high blood pressure, and then take special note of hypertensive crisis. Once you get over 180, over 120, that is potentially immediately life-threatening, and you need to get some help for that right away. Controlling cholesterol, there are a variety of ways to go about this. As you all know, there are a variety of drugs now that can help control cholesterol, but in the early stages at least, having a healthy diet and exercising may be all that you need to bring those numbers under control. So don't wait until they're really out of line. Get in there and take some action with physical activity and with diet to start managing those numbers before they get out of hand. Reducing blood sugar. It is estimated now that 1 in 3 to 1 in 4 of us in this country have prediabetes. What does that mean? That means that it's not to the point where your blood sugar is abnormal, but your body is working overtime to pump out insulin to keep it normal. The end stage of that whole process is diabetes. So it's important now to know what your hemoglobin A1C is. You don't necessarily look like somebody who would have prediabetes, and you don't know unless you check it, unless you're working with your healthcare provider to understand that. And then your food choices may be different than those who don't have a problem tolerating carbohydrates. And that's a good time to speak with your healthcare providers as well, and to, again, commit to physical activity. All right, what about stress? Well, We talked about it earlier, that resilience is what we're going for here, because all of us are going to have stress. That doesn't mean you don't try to reduce it in your life. If you're overextended, certainly pull back a little bit and take care of yourself. Whatever great things you're doing, they're going to get done a lot better if you're alive than if you're not, or if you're out and about instead of being laid up in the hospital. So the ability to withstand, recover, and grow in the face of stress is really what we're after. There are specific strategies that we can take to do that. The World Health Organization, by the way, names stress as the health epidemic of the 21st century. Life seems to go faster and faster. We're always on now with our phones and our computers and our digitally connected world and social media. There are a tremendous number of potential stressors that surround us day and night these days. So meditation, you know, some people think woo-woo when you say that word, or that it's associated with a religious approach. It certainly has its origins in many religions, including Christianity. And what it does is it helps to treat anxiety, depression, and lower stress. And it may, in fact, decrease the risk of heart disease. And really, the concept here, it doesn't matter what kind you do or how you do it. Sometimes walking is a meditation for some people. Swimming can be a meditation for some people. So it's not how you do it, but what you do is you take your brain offline for just a little while and let it rest. So you're focused on something that's easy, that's straightforward. It might be your breath, it might be your steps. But whatever it is, it takes you out of that merry-go-round of thought after thought after thought of what you need to do next and what you didn't do and what you should have done. All of those things add to our stress in daily life. And by the way, turning off the electronics periodically can also help a lot with reducing that level of bad stress, if you will, in your life. This is one that we haven't thought about. I mean, it's been part of our strategy in this country to think about, you know, I can sleep only 4 hours a night and look how accomplished I am and look at all the stuff I get done. But the truth is, most adults need 7 to 9 hours of sleep each night, and kids and teens need even more. Rarely do they get enough. Rarely do we get enough. About 1 in 3 adults don't get enough sleep. That has a lot of consequences. You're more likely to make impulsive moves with your eating. You're less likely to feel like exercising. And so there's this cascade of negative events that can be the result of not getting enough sleep. And there are other problems too. If we go to the next slide, good sleep can help you repair your cells and blood vessels. There's a process of clearing the brain each night, flushing out the brain each night that we now know that takes place with sleep. You're going to be more creative and productive during the day. You're going to have better brain function, learning, memory, focus. You're better able to build muscle if you're rested, so your exercise will pay off more. And we do know that it decreases the risk of chronic diseases. And there is an association, we know now, between sleep and Alzheimer's disease. Improved mood and energy go a long way, as does for kids. Healthy growth and development is critical. And we want them to be able to learn in school. Quicker reflexes for driving. One of the biggest risks all of us take every day is driving our cars. And doesn't it make sense to be alert and focused during that process? And finally, your immune system functions much better when you're well rested. So what kinds of things can we do? We're going to focus a little bit here on electronics. Your device, and we see this all the time, and it's blue light, and it's attention, and it's the dopamine hit, as they call it, the feel-good chemicals that you get when you get a ping on LinkedIn or a like on Facebook. So when you're getting ready for bed, even before you go through your routine to lie down, charge your device and do it somewhere away from the bed so you're not tempted to reach out and check that one last time. Before you stop using your device, as day goes into evening, you ought to be dimming your screen or using a red filter at night. And set an alarm. I mean, we use them for waking up. How about a notice that, hey, it's about time that I got into my routine to get sleepy for bed. And finally, you can lock it. And there are apps that can help you do this to keep you from using that phone, particularly when you're trying to wind down for sleep. Oh, yeah, and you can block notifications. And by the way, there are easy ways to do this. People are worried about missing emergency calls. You can have certain numbers that pass through no matter what, but you can block all the other stuff, all of the stuff that's not critical, that can wait until you're well rested. And Corinne, I just have one more thing that I want to say. I'm going to turn it back over to you to talk about the resources here, but we talked about the Simple 7+, and I want to make a recommendation that's a great way to think about things, but if that's too many, there really are 4 that impact all of those, and that's the healthy diet, physical exercise, sleep, and stress management. Why is that important? Because if you do those 4 things right, you're less likely to need to smoke to manage stress. You're less likely to let your blood sugar get out of control. You're less likely to have hypertension. So all of those things can combine to lead to a much higher risk of heart disease. And we're trying to give you some simple strategies to make sure that doesn't happen. Simple doesn't necessarily mean easy, but as I said, it's worth it. So Corinne, back to you.
Thank you so much, Dr. Groves. And that is very true. Simple to remember doesn't necessarily mean easy to implement, because we have so many of the processes in our lives already going, but it really is true. What you eat and if you move impact your blood pressure and your cholesterol so much. So it really does kind of boil down to some of those basic things. We appreciate you taking the time to share this information with us. There was a lot of information we covered, but on this slide here, we have some additional resources for folks. And like I said, we'll send this presentation out afterwards. We have mylifecheck.org, where you can go to get your free heart health score. You put information in about your Life Simple 7, and then you get a customized report back as far as how you're doing and simple tips and recommendations for what you can do to improve your score, which basically means to be closer to better heart health. We also have a lot of free healthy recipes. As Dr. Groves mentioned, when we cook at home, we're less likely to have extra sodium and extra fat in our food. So recipes.heart.org has a lot of recipes for you. We also have wellness tips in general at the Heart Association at heart.org/healthy4good. And then also tips on sleep health. And then also at heart.org/sleep, but then also stress and mental well-being at heart.org in general. So with that, thank you guys. We do have time for questions, so we'll start that. I'll start with the ones that were submitted in the chat box first, and then from there, if anyone else has other questions, please feel free to submit them as you go. So the first we have is not necessarily a question, but an observation. Several folks really enjoyed the video with Elizabeth Banks, and were commenting that they had no idea that jaw and neck pain were signs of a heart attack. Really something so easy to overlook or to write off, but can mean the difference between life and death if you're not acting quickly.
Great information.
Our first question is, how does someone determine their carb tolerance?
Yeah, so that's something you want to work with your provider on, but here's a couple of things that we do routinely and some that we don't that you may want to ask about. One is you can get a fasting blood sugar checked, and or even a non-fasting blood sugar, if it's high enough, will give an indication that you're not tolerating carbs very well. But a fasting blood sugar, should be below 100. In other words, after you haven't eaten for 12 hours, your blood sugar should go down under 100. If it's over that, then there is some concern that you may not tolerate carbohydrates as well as you should, or your diet has excess carbohydrates for what you need. The other way is something called a hemoglobin A1C, and it's a hemoglobin that's glycosylated, and the reason that it is because of blood sugar. And so there's an equation that will give your doctor an estimate of what your average blood sugar has been over the last 3 months. And there's a normal range, there's an intermediate range, And then we get into the diabetic range. In that intermediate range, that's what we typically call pre-diabetes. Now, if you've ever been pregnant, which I have not, you will also know that an oral glucose tolerance test can be done. And that's where a certain amount of glucose is given to you, and then your blood sugar is checked at 2 intervals, sometimes 1, depending on the protocol, after that known glucose load, and your doc can get a good idea of what your tolerance is that way. The final way, that's not routinely done, but sometimes done to fine tune this, is checking your fasting insulin levels or your glucose tolerance test insulin levels. Because there are people who seem to have very normal blood sugars, but their insulin levels are already elevated. And that's an indication that you're moving in the direction of diabetes. That's what we call pre-diabetes. So glucose and hemoglobin A1C and variations around that theme are the way that we typically identify folks who have a problem with carbohydrates.
Thank you. And what causes plaque?
Yeah, that's a great question. That's something that's been studied for decades. Originally we had a pretty pure conception that you were eating too much cholesterol. That's what it was. Eating that it was purely because of eating too much fat. That's not the case now. It's a much more nuanced and complex interaction. First of all, genetics. There are certain genes, ApoE genes, that predispose folks to developing plaque. So if you have a family history, that's a marker that you don't handle the arteries very well, the stressors. And now we think that chronic inflammation plays a role as well, that wear and tear and chronic inflammation lead to these little cracks in the garden hose, if you will, and the plaque is kind of like the spackle to fill it in. And it gets overdone after a while if there's a constant irritation of those vessels from high blood pressure, inflammation, a variety of factors. Transport of fatty acids clearly plays a role. There's no doubt about that. It's not just cholesterol. You'll hear a lot about the good cholesterol, the bad cholesterol, et cetera. So this is something you really want to go to a healthcare provider to sort out. There are familial diseases, inherited diseases, in other words, that result in very high levels of certain fatty acids and cholesterol. And then the metabolic syndrome, the pre-diabetes syndrome, is often associated with very high triglycerides. So it becomes a complex interaction that you really want to talk with a provider about before you make a determination about your situation in particular.
It relates a little bit to, are there any obvious symptoms for someone who might be pre-diabetic?
Yeah, there may be none. There may be absolutely none, and you may have had a normal fasting blood sugar before. And if you don't go and measure the hemoglobin A1C or insulin levels, you may not find it. Certainly if you have a family history, but there's something called the metabolic syndrome that is typically associated with being overweight, particularly belly fat. A lot of belly fat is an indicator that you may be pre-diabetic. And the high triglycerides, as I mentioned, are part of the metabolic syndrome. And so when you look at the rise in obesity in this country, tracking along with that has been a rise in the level of prediabetes and the risk of diabetes. So if you're overweight, or certainly if you're obese, that's a big marker for the metabolic syndrome. And as I mentioned, particularly that belly fat, and hypertension usually tracks along with this in the so-called metabolic syndrome. The metabolic syndrome is the precursor to prediabetes, which is the precursor to diabetes. All of them have a negative impact on your health.
If a young woman is diagnosed with high cholesterol, is she also at a higher risk for a heart attack later in life?
That is a somewhat nuanced question. In general, yes, higher cholesterol tracks with higher risk of heart disease. It is possible to have too little cholesterol too, I might add, not usually a problem in this country, but there are certain syndromes where that's a problem, as my my dad, who was a primary care physician, very practical guy, used to say, you got to have enough cholesterol to make cells. And that's certainly true. But that would be something that I would definitely address with my caregiver and ask that question specifically. And most of the time, the answer is going to be yes. In the absence of something to control that, it's going to increase the risk.
And then someone was talking about hands-only CPR and talking about compressions. If the person is breathing, you should not give compressions, correct? And the answer is correct. It's someone is unconscious and not breathing that you would then give the compressions. But if they're breathing, then what it means is it's probably not a heart attack that has caused that problem.
Yeah, and there are some other nuances that you can learn to assess that. But the 1-2 step thing is for somebody who has gone down quickly and they're not breathing. And you can check that by putting your head down close to the face or watching the chest rise and fall. And there's some other tricks that you can do for checking for pulse and things that are a little bit more nuanced. But if you're really interested, then those things you can learn too. And it's not that difficult to learn what to do in those situations as well.
Yeah, and we have a lot of information at heart.org. We have an entire portal for CPR where you can look and find where you can actually get CPR certified nearby. And during the pandemic, there are several centers offering online classes. Obviously, for hands-on practice, you don't get the certification, but there are online classes that you can have where there's even more detail in CPR available too. There were some questions about lower heart rates, that if your heart rate is at the lower end, like 52 as a resting rate, is that an issue? Can you have too low of a heart rate?
It's interesting because that can be good or bad. For someone who exercises vigorously, particularly endurance exercise, typically they will have a very low heart rate, and you'll see marathon runners who get down in the 48 range. There's still a lot of debate about whether that's really healthy to be that slow, but the 60s are not a concern for someone like that. Now, the other end of the spectrum is you can start to see lower heart rates when you have disease of the electrical system. And sometimes that can increase the risk of escape rhythms that can be chaotic. And remember, that pump needs to be highly regimented and sequenced. And so if it starts to beat chaotically, it's not getting the pressure it needs to keep the body filled with oxygen. So the answer is it depends. And that's something that I would check with too, depending on which side of the spectrum that you're on.
Perfect. And then we had a question about the works of Doctors Dean Ornish and Caldwell Esteen, and what your thoughts are on their ideas of reversing heart disease.
Yeah, Dean Ornish has done some great work over the years, and his approach is as you know, a very low fat, whole foods, a lot of vegetables approach to managing heart disease, and that does work. It is, he's proven it. He's published data on this, and we probably have enough of a long-term look at this to know that, yeah, that's a good strategy. It's not for everybody, but it's a good strategy. On the other end of the spectrum, we're learning that, sometimes diets that are almost on the opposite end of that spectrum for people who are really carbohydrate intolerant can work as well. So it really comes down to the individual and what works for the individual. And we want to work this so that it's not a diet, right? It needs to become part of your lifestyle. If it's not, you won't stick with it. And so working with somebody who can help you navigate all that is the real trick, to find something that works for you, that optimizes your body and is optimal for your carbohydrate tolerance. It may be Dean Ornish, but it may be something different from that.
Perfect. Well, we are at the end, so that's all the questions we have time for today. Thank you again for joining us for Understanding Heart Disease with Dr. Groves from Banner Aetna. After the webinar, you're going to receive an email with a link to the recording, as well as a PDF of the presentation and some infographics, including a link to a feedback survey. So it's a quick survey, so please let us know how we did and what you've learned. And you might even win a $5 Starbucks gift card. So we will have a random drawing for some Starbucks gift cards for everyone who completes the survey. So thank you again, everyone, for joining us, and have a great afternoon.